the goal of our study really was to identify what types of information parents want from public reporting and how they want it to be displayed. We've had parent groups, approach us and say that what we're doing now is a good effort at public reporting in congenital heart surgery, but it's really not meeting their needs. So we wanted to survey a huge population of parents that was nationwide and diverse with respect to multiple different socioeconomic factors, and find out what they want from public reporting, what types of data they want included, and how they want it to be displayed to them.
And you found that survival statistics, surgeon-specific experience, and complication rates were the main types of information that they sought. Were you surprised by those findings?
Yes and no. I think it makes sense intuitively to me that parents would want to know survival statistics about the procedure that their child is about to undergo. I'm not a parent, but if I were a parent, I think that would be most important to me. What was surprising to us is that parents really valued surgeon-specific outcomes data above and beyond center-specific outcomes data. So they really wanted to know how the surgeon who would be treating their child does for a particular operation. That was probably a surprising thing to us. And that metric ranked above other metrics such as quality of life outcomes, like will my child be able to go to high school, will they be able to live independently, and complications data, which was a close third in our study. So that was the surprising finding for us.
What does this say about what the ideal public reporting system should look like for these patients?
I think what our study really highlights is that we're doing a good job of public reporting currently, but what we're doing isn't enough, or it's not meeting the needs of all of our stakeholders, in this case the parents of children with congenital heart disease. So the optimal public reporting scheme still has yet to be determined, but I think in the end it'll shake out to be a combination of what we currently have, some sort of, whether it's a star rating system or other categorical measure that ranks on a high level hospitals from A to Z, and then along with procedure-specific data. So parents really emphasize that what they want is procedure-specific information. The STS currently reports outcomes data for categories of operations, but not for specific procedures. So what was emphasized again and again to us was that parents want to know how their child will do based on the operation that they need. So some hybrid system in the future that combines maybe a star rating system or other data of that type along with procedure-specific information will be where we shake out.
Do you plan to conduct further studies in this area?
We do. So one of the big things we want to know now is how parents understand the data that we give to them. So our study did a good job of showing what parents want in terms of the type of data and how they want it displayed, but we didn't ask if they can understand the data if we present it to them in that way. So we plan on, in our next iterations of the study, trying to test understanding of data in multiple different formats.